o'clock, living. We talked last week, actually, about marijuana, mental illness, and I know a lot of you guys call us and send us emails. A lot of questions you have about this disease entity. So this is your program, mental illness and marijuana. How good is that? Is it really good? No, I want to caution you first of all. It's 9:05. On Saturday morning, and we come to you every Saturday from 9 to 9:30 and talk about living and things that we do as we live, as we travel this journey. I want you to get to the phones and call us and let's talk about it and say hallucinations, depression. We talk about anxiety. We talk about depression. All of these things that are associated with use. Excessive use and use. Remember, there's always something called idiosyncrasy. We'll talk some more when I come back. Yeah, Bob Marley. Lively up yourself and living. Now, 434-1791. 434-1790. 434-1771. You can call us. What do you think about smoking? You see, most people who smoke marijuana, they smoke cigarettes too. They mix the two together. And I mentioned the last time that, you know, smoking in itself, if people who smoke normally smoke for longer periods, that's tobacco. Marijuana smokers stop. And that is why the studies, you're comparing the two. You can't compare longitudinally what the effects of marijuana is, but a lot of carcinogens are present in marijuana. When you smoke it, so cancer, the lung, the throat, the mouth, the stomach, the prostate, bladder, the genitourinary tract, cervix, and so forth, and also heart disease. All are associated with smoking marijuana. And if you smoke it, and it is proportional, directly proportional to, you know, the time that you smoke it. So, you guys out there, we could have some nice dialogue for the next 20 minutes or so that we have. Let's talk about it. What are your thoughts? Today, I came, as a matter of fact, somebody called me this morning and said, well, you know, Dr. Sparman, I want to tell you about something that happened to me. And he says that he, not a very frequent smoker, not very frequent. But it's just one day he was traveling and he was in a plane and a voice was telling him just to jump. And he says he couldn't get his voice out of his head and just keep to jump. And he said he had to go and hit some people next door and ask them if they could give him something to read so his voice can go away. But yes, THC is what we are talking about. The tetrahydrocannabinol is one of the potent substances present in marijuana. And, you know, you can do so many things with marijuana. As a matter of fact, you can, some people, there are different names we have right out there. We have hash, grass, weed, AK-47, all these type of names that people have for it. Spiff, you know, native names, different same things, different potencies and all type of things. And some people, smoke it, and some people would even put it in a resin form to increase the potency. So, I'll come back and talk. Don't forget 434-1771, 434-1790, 434-1791. And you call us and let's talk about what's your experience and what are your thoughts about this whole thing. Eagles, you know the Eagles? Hotel California, there. But that was a big hit in there. What year was that, Dennis, when it came out?
Hotel California was the late 1970s, 79, somewhere there, close to 1980. It was a monster hit for
Oh, my goodness, man. He still got his bite. Guys, I'll see you when I come back. Yeah, you guys, you like that, don't you? 1976, man. It was a big hit. 13 weeks. Number one. Yes, good morning, you dear.
Good morning, Doctor.
Yes, ma'am. How can I be of service to you today?
Rita Wharton. I don't want to forget the voice.
Okay. How are you doing, Miss Wharton?
Yes. I'm okay.
A good Saturday morning to you.
Yeah. But my husband, see, he never smoked cigarette. And at night when we lie down, the fumes of the cigarette used to humble me. I had to back my husband.
Oh, well. Is your husband still with us?
Yes, he's still living.
How old is he now?
I think he's 86, you know.
Yeah, you see, and this is a thing that confused, and thank you for calling. You could just hang up and listen, actually. Basically, smoking, we talked about idiosyncrasy, and it has to do with our genetic makeup. And you know that all of us are different. I don't care. I have twins, I have identical twins, and but still they're different because the synapse, when that merging of the egg and the sperm, it's all different. So, what someone may be able to tolerate, the other one would not. You say, all right, a guy's 86, he's smoking, man. Nah, smoking can't do anything to you at all, so I'd smoke. But do you know that if he didn't smoke, he probably would make 115, huh? So that's what it is. It means he has a gene for longevity, but he smoked, and whatever age he would have reached, I guarantee you, 20, 30 years after that, he probably would have made. Now, the Surgeon General has reiterated, actually, recently, that passive smokers have the same risk of heart disease and cancer as smokers in themselves. See, it's by inhaling that smoke, the carbon monoxide gives you, matter of fact, it gives you heart problems, and also because it has an affinity for red blood cells, and also this inhalation of the smoke actually destroys the lungs, and the same passive smokers can get all of the cancers that I mentioned before. So yes, if you smoke, it's not good for you. You're destroying this temple, and then on top of that, you're destroying the people that you love. So if you smoke in the house, and your children are around, and your loved one around, it's not good. So listen to me this morning. Passive smokers are people who are around smokers. They have the risk of all these deadly things and cancers. So please, be nice. Yeah, be friendly. And, if you're going to do it, I'm saying not to. But if you're going to do it, be away from these wonderful loved ones. Thank you, man. Thanks for calling. Good morning. You're on the air.
Hello?
Yes, good morning.
Hi. You're dealing with mental health issues as well?
Yes. We were talking about this the last few weeks.
Okay. I've never been a smoker, never been a drinker, really. Maybe a glass of wine, maybe once in a blue moon.
Okay.
And I had, like, a mental illness that they called it bipolar.
Okay.
And I've been on this medication, I think maybe for too long.
Mm-hmm.
I was wondering. Mm-hmm. I know I have dealt with a lot of the issues too, the low self-esteem,
Mm-hmm.
a lot of things that I won't even want to say on the air.
I got you.
And I was wondering, like, don't you think it's time I can come off of that medication?
Oh, well, yes. You know what? I must say thank you for calling. Good morning to you. And listen, I'm going to talk to you, okay? I will talk to you. Yes, you can come off and I'll talk to you, but no, I'll just talk to you and you can listen. You could come off the phone and listen, but this is important for you. You like it, and thank you for calling. Now, let me explain to the listeners what bipolar illness is. We call it manic depressive disorder, where you find that it has to do also with a genetic makeup. Some people are predisposed to it, and some people, it just happened from their gene, and then it can be passed on to somebody below, down the generation gap down there, grandchildren or whatever. But the thing is, it's where you become psychotic at one time, and then what psychosis is having been on a real high, spending a lot and just doing irrational things, and your temperance being very, very, very low for people, and being antisocial, actually, aggressive person. And then you slip right back into this depressive mode, depression, where you just sit down and cry. Why are you crying? And you don't want to live, and suicidal thoughts and all these things. So it's a disorder that a lot of people are affected by. A lot of stars are affected by this disorder. And what do? You find the medicine we use. Sometimes they use lithium and other medicines that are good at stabilizes the membranes of the nerves so that you can live a normal life. No, my question to the caller was, could I come off these medicines? No. Because the concept that we entertain is that, I'm better now, and we're now in a normal life and everything. Why do I need this medicine? What if it happens? It went away. No. You keep taking that pill every single day for the rest of your life, so you can live a normal life like everyone else. You stop, and then what happens most probably, the symptoms will reoccur. And what it does a lot of trauma to your body. And then you get the pills again to get back to stability. You're not where you were before. So yes, you've done very well. Eat well. Watch your meal, exercise, keep taking your pill. And I thank you for calling, and you'll be okay. Somebody in the air. Good morning.
Good morning, Dr. Sparman.
Yes, good morning.
Yeah, what I want to ask, this marijuana can be used any other way other than smoking it.
Yes, good morning to you. Good question. Yes, people use it. I must caution you, though. I'm gonna say it again. It's illegal to use this stuff, man. You can do some time, some places you don't want to be, actually, and your freedom taken away from you. So, no, it's illegal in this country. It's legal almost everywhere. Matter of fact, in the 1940s, it was legal in the U.S., and then because of political pressure, they had to remove that. The federal government and so forth. So, no, smoking marijuana, not something you want to do. Don't do it, kids. Don't do it. Nobody out there, okay? Now, some of the uses of this marijuana, some people use it because of nausea, vomiting. Cancer patients, when they're having cancer, they have the chemotherapy. They use it for that, and some things like glaucoma and some type of disease entities they can use it for as medicinal. But that has to be prescribed by doctors somewhere overseas, but not here, really. But yes, the question was, could you use it in other forms? Yes. Some people, apart from smoking it, some people chew it. Some people even get it in a liquid form and inject it, and these type of things. So there are other ways that you could people administer these type of drugs, but really the amount of things that can happen, the hallucinations and a lot of, and you see a lot of times you go into the hospital and you wonder why you go in the hospital with one illness and you come out with something else. Yes, you may have some illness right under there waiting to happen. Marijuana would just push you over the edge. But yes, sir, there are other ways that people will do it, but most times people, they smoke it. We got a caller. Could you hold on a second? I'll be right back, man. We got to get the Sweet Eagles back, a little bit of it, and then I'll come back and talk to you.
Hello, good morning.
Morning, you're on the air.
Morning, Doc. How are you?
Not bad. How can I help you this morning?
Well, I had an ultrasound done about 2 weeks ago,
Mm-hmm.
and there is one part that say at least one calculus is seen for kidneys, between 5.5 mm and 6.5 mm in size.
Mm-hmm.
But I want to know if that situation is crucial or what is it?
Well, yeah, you ever had severe back pains?
Very much.
Mm-hmm. And how often you would have had things like that? Once it happened or recurrence?
The back pain?
Yeah.
Well, I got a pain at the lower end of the back.
Mm-hmm.
And one time my doctor told me that the discs in the spine, they're slipping.
Oh, I see. Mm-hmm. Well, you see, a lot of times what happen basically is that you have the stones that you have in your kidneys. Mm-hmm. If a piece is released, it normally goes and it gets hooked up along the ureter that goes down to the bladder and causes severe pain. Kidney pain is extremely severe. But yes, so that's the risk of having pieces of those go down and block up that tube, and then it could damage your kidneys eventually because your kidneys get enlarged and the tube get enlarged and so forth. You could have kidney dysfunction.
Yeah.
So what is recommended for patients like these that they should not eat a lot of or drink a lot of acidic or eat a lot of acidic foods.
Okay.
So try to drink a lot of coconut water. Drink lots of water.
Yeah.
And alkaline stuff. Coconut water is alkaline. And then you could talk to some doctors about or some pharmacists about alkaline tablets. You take like one or so a day and so forth. If you keep your body alkaline, then the stones, a lot of times the stones dissolve, and a lot of times it does not reoccur. But in an acidic medium, if you don't drink a lot of water, yes, you can have a lot of stone formation, and then if it clogs up, as I said, clog up that ureter, ureter actually, you can have kidney dysfunction. So you have to watch it closely, and what I would say is see a nephrologist, kidney doctor.
Okay.
And a lot of times there's something called lithotripsy, where they can just take these machines and shock the stones and break them up into small pieces, and you get them out of the body. That's the approach I would do, but be careful. A lot of coconut water, lots of water. Keep your body alkaline.
So this alkaline
Is it tablets or liquid?
Yeah, there are tablets you can take, actually, and,
So I could go just in the pharmacy?
No. I would see the nephrologist first. Start off with the coconut water and lots of water.
All right.
Thank you for calling.
And thank you so much.
Yeah, it's a pleasure. Okay. Lenny Kravitz. I like that guy. That was Lenny, and over until it's over. And we were talking for the past half an hour or so about, in the last couple of weeks, about mental illness. And today we finished up about marijuana, and we talked about the different forms, the resin and the herbal cannabis. And we talked about THC, which is the potent compound present in marijuana, and how much it can affect you. And we talked about suicide. We talked about how it can cause schizophrenia, which is a form of psychosis, depression, and so forth. So be careful out there, guys. And your brain cell, don't forget it hallucinations, and it messes up your memory. And a lot of people, you see people who go to school, you taking marijuana and so forth. Their studies have shown that they're more apt to be absent from school and things like that. So important things that you're supposed to do, you're not doing, and all of these things. So be careful out there. There are other things to do. Go swimming, ride a bike, go bowl, and all these nice things. Take up your time and do other things that may be more constructive in your life. I want to thank you for listening to us today, and don't forget www.thesparmanclinic.com. You can get this program there. We have them in the program. If you miss it today for whatever reason, and then on top of that, you could email us. dr.sparman@sparmanclinic.com. It was nice speaking to you this Saturday morning, and we love you and care for you. And when you live beautiful. Take care of this temple. Take care of this body, and I will see you next week.
Boys on Barbados.